My name's Megan Copeland. I'm a peer recovery support specialist in the state of Arkansas, and I work as the lead peer for ABIN, Arkansas Behavioral Health Integration Network, and I'm also a project coordinator for them. So what do I do as a peer recovery supervisor in training, and how do I support other peers? For the first year of my career as a peer specialist, I worked in direct services through the Division of Youth Services, and I stayed there for about a year. It's a challenging age group to work with, but I just jumped in feet first and immersed myself in it and learned a ton. And then after that opportunity, I was able to go to work with Arkansas Behavioral Health Integration Network, where I work now, and I get to work on a broader scale, a more macro level versus micro level. So I get to work more on grant projects and impacting the state as a whole versus those direct services. Integrated health to me is the person-centered entire team effort to give the patient, or the peer in my instance, that you're working with the best care possible, where everyone knows what's going on with each other. So that's the uniqueness about ABIN. Their mission and vision is centered around integrated healthcare. So being able to learn about that and to help employ it throughout Arkansas has been just very valuable to my own knowledge and also to help the citizens of Arkansas. So peers play a part in the integrative team because they come in with that lived experience piece. They're able to connect with the peers at a different level, and they have that immediate bond because of shared life experiences. So we walk alongside the peers that we serve to provide resources, while the healthcare team or the social worker may be working on mental health issues. The healthcare will be working on health issues. The peer can come in and walk that person through what it's like to be in recovery, how to get your driver's license back, how to get connected to resources in the community, how to get enrolled in college, just those basic life things that in early recovery seem very unimaginably huge. Rural Arkansas has a lot of challenges compared to more metro areas. There's the lack of resources in the area. There's, poverty issues in a lot of the rural counties. So not having access to proper health care, proper mental health services, and even peer support. So with peers being new to Arkansas, we are employing more throughout the state. So more and more are available. It's just knowing what resources are out there and how to get in touch with them. My role as a peer supervisor in training is to make sure that the peers that I'm working with have access to continuing education, have access to job opportunities, have someone that they can have mentor them through their walk as a peer support specialist to make sure that they're following the ethical guidelines, to have that support successful in their own career path. So my passion for peer support comes from my own lived experience. So I started using drugs and alcohol at the age of 14. And it wasn't until I was 28 years old that I finally found a way out. And back then, I'm dating myself, I know, there wasn't such thing as peer support. So if there would have been that role model in my life that could show me how to walk the walk and how to live a life outside of just using and the lifestyle that comes along with that, it would have played a huge role, and maybe I could have found recovery earlier. So if I was to speak with someone that was needing help, I would encourage them to reach out to a peer in their area. You can go to arpeers.org, and there's actually a list that's county specific where you can find peers located in your area. And also you can always reach out to me at megan.copeland@abinnetwork.org. That's ABHI network.org. If we're talking about what needs to be done through the legislature, there needs to be a way to pay for peer support services. So this part of the integrated healthcare team is vital, and we all have our own specialties, but that immediate connection, it pulls people in quicker. It builds that bond that can be developed through no other career path. So if we could find a way to support being able to pay through peer support through Medicaid and other avenues, that would be key to continuing this work.